don't worry, a lot of this is pictures and review and things like that. Okay, so let's start out with a case study, shall we? 10-year-old girl comes in complaining about a rash on her trunk. Rash does not extend to her hands or face. She mentions having multiple sore throats over the past year. She also says that she has pain in her fingers, wrists, and knees, joints, right? She explains she has been experiencing involuntary wild twitching of the muscles. Upon testing, a throat culture finds strep A, CBC indicated CRP and increased white blood cell count. ASO tested positive for strep antibodies. What is this condition she's experiencing? Huh? Does she? She had definitely came up positive for strep, right? And she has what?
She has a rash on her hands.
And she has a rash. Is it on her hands?
She does not have a rash on her hands or face.
Okay.
And she's twitching.
And she's twitching, which we call chorea, right? So again, strep that gone bad, aka rheumatic fever. Cool. Make sense? Questions? All righty. So that is our going to talk more about respiratory problems. So Ethan really likes spicy foods, even though they give him heartburn. In fact, he likes spicy foods almost as much as he likes to drink alcohol and smoke his favorite cigarettes, which he does as much as possible. For the last year, he has had acid reflux pretty much constantly. Now his throat is really sore. His doctor is concerned that he's causing damage to his esophagus that could lead to cancer. What is the esophageal condition called?
Barrett's throat.
Could be Barrett's. I was kind of backing up a little bit off Barrett's, but what's the step before Barrett's? Huh? GERD, gastroesophageal reflux disease, right? Which, if it's untreated, it could lead to Barrett's, and untreated Barrett's could lead to the esophageal cancer. Incidentally, it's an adeno, A-D-E-N-O, adenocarcinoma of the esophagus is typically what we're talking about. So what is a normal esophageal pathology or histology in the epithelium of the esophagus? What is normal? Stratified, squamous, or squamous, as some people say. What type of cells now do we have? If it's GERD or Barrett's, even more accurately. Huh? What did they turn into? The stratified squamous cells have an acid coming back up, back up, back up. It's got to protect itself. Stratified squamous turns into what was here? Columnar, which was what was in the stomach. Long column-like cells keeping the acid from the basal layer, right? So it doesn't eat through. So it's protective, right? So they just kind of move on up, and now they're in the esophagus, and then we would call it actually Barrett's esophagus. Looks really red, inflamed, right? That eventually could. It's only like 1% of the time, by the way, it turns into cancer, but it can happen. Okay. Is it reversible at this point? Yes. Therefore, what kind of plasia is it? Metaplasia, right? That's the one that is changeable, like metamorphosis, right? You can change back and forth. Although it doesn't really work for butterflies and caterpillars. Works for the Hulk.
Most of the time.
Okay. We may have some holes in our language. What can you do to treat or cure this condition?
Lifestyle change.
Yeah, everything here, stop. Right? Okay, guess what? Ethan's not going to do that. He might. You got to recommend it. However, what else can you do to help? Tums? Sure.
It's just going to keep him going.
Huh?
It's just going to keep him going.
It's gonna keep them going. Well, I mean, you know, if you add a buffer into acid, it's going to neutralize it. He's just gonna eat a lot of Tums if he continues creating all that acid, right? I mean, it will neutralize it. It'll definitely treat the symptoms. And it won't get worse if you're constantly eating Tums, although not sure how you could eat that many of them. Yeah? What? Sure, but why? Sure, but why? It can, when somebody has chronically too much acid, but that would be a little unusual because it's got to go a long way before you get to the colon part of it, and it's not like the intestines aren't used to dealing with acid. But it's possible, absolutely. Yeah, absolutely. Oh yeah, never did get to this. Let's talk about some medicines other than Tums. Omeprazole, or even better, pantoprazole, which omeprazole you can buy at Walmart over the counter. Pantoprazole's prescription, much better, by the way. Same idea though. Sure, but why magnesium?
Together with omeprazole and magnesium?
Yeah, I think they do throw magnesium in there. Not exactly sure why they throw magnesium in there, to be honest, but I think they do. Magnesium is thrown in a whole lot of stuff. It's like mostly what post-workout is, you know, to keep your lactic acid from building up. Magnesium is weird. It has all sorts of weird little... Anyway, I digress. So we have your proton pump inhibitors and your H2 blockers, right? That's your two main categories of antacids. One of them is ranitidine, or derivations thereof. One of them is omeprazole, or derivations thereof. Ranitidine is the one that you take if you want to get immediate acid relief. It's only every once in a while when you need it. The omeprazole category is you take those every day because you have a chronic long-term issue. Okay? What are we looking at?
Swollen tonsils.
We are looking at swollen tonsils. Tonsillitis are swollen tonsils, yes? What? Why? Why does this person have tonsillitis? Can you tell by looking at this? Hmm? Why strep? Yeah, it's not just that it has white patches, which is true. This one is actually running in these strips. If you look at a petri dish, I'll show you one in a second here, about when you actually culture strep in a dish, it actually tends to run in strips. And this is like totally classic as classic could be. It's not always going to be that clear, but this one's pretty darn clear. Huge tonsillitis and these strips of white. Cool? 4 reasons for a sore throat. What are common reasons for a sore throat? Let's say strep is one of them. What's another? It's a regular cold or flu, right? That's pretty typical. Probably the most common reason, right? Sleep with their mouth open.
Yeah, then you wake up and your throat's all sore. My mouth would be there all night.
Mouth breather all night. All right, gets all dried out. Yeah, that's actually true. Okay. Yes, allergies too. Anytime you're laying there and you got something dripping on the back of your throat, postnasal drip all night, you wake up with a really sore throat, right? So, yeah, allergies. Usually you are mouth breathing when you're doing that too, because you can't breathe out of your nose anyway, right? Mono, of course. Did you know that? Did you know mono also gives you a sore throat? Mono actually can put white spots on the tonsils. However, I'm going to go ahead and pretend I didn't say that for this class for testing purposes. It's actually not uncommon at all for somebody with mono to have white patches on their tonsils. But we do have to figure out ways to test you guys, right? So sometimes we have to kind of back off a little bit of reality. So we're going to say, you see white patches on tonsils, bam, big buzz for strep, right? Mono, we're going with the hepatosplenomegaly, exhausted for several months on end kind of thing, right? Does that make sense? Oh, here's a strips of strep. Okay? Alrighty. You guys were listing all of this stuff, right? Allergies, you said. GERD, you said. Dehydration, mouth breather. That's, a tumor, smoking, of course, that's on everything, right? Oh man, look, we still got lymphadenopathy, fever, fatigue. Those aren't your big things, are they? Because we saw those the entire time we were talking about the leukemias and lymphomas, multiple myelomas, all that, right? Saw that over and over and over again. However, we're definitely having trouble swallowing, dysphagia, painful swallowing, and the white patches, of course. So, good news is we have something called a rapid strep. Strep sucks?
Yeah.
Did I ever ask you guys before how many people you ever had strep? It was a bunch of you, wasn't it? It was like half the class or something. And you had it like a lot. Yeah. All right. So pharyngitis, laryngitis. What's the difference, by the way? Pharynx or larynx, duh, right? Which one's higher up? Which one's lower down? Pharynx higher, larynx is lower. Larynx starts with the L. That's why it is the dividing point between the upper and lower respiratory system, right? Remember that? Okay. Larynx L. That's the lower respiratory system starts there. If you didn't know that already, it's one of the things we say all the time in earlier anatomy classes. Okay, so what do I have here? Oh, strep throat is treatable with antibiotics, unlike colds and flu. Why? Because it's bacteria. This is one of those things that I throw in just to kind of remind me a little bit. Have you ever done that? I don't know, maybe you haven't yet. You will, I promise. Some of you guys, I would be like somebody would mention something like this to me. And I'd be like, I should have known that 10 years ago. And then you feel really stupid when you're like, oh my gosh, that is so. Have you ever done that where you're like, okay, I probably should have known that a long time ago, and then I'm just finding this out, and it's like an epiphany, and everyone around is going, yeah? Right? Anyway, it's kind of one of those things that sometimes people don't actually make the connection of antibiotics are only for bacterial. Anyway. Moving on. Okay, so where are we going with all this so far? Now we're getting into yet another problem with that strep, that group A beta hemolytic strep. So we saw that, of course, it causes strep throat. We saw that it causes scarlet fever, rheumatic fever, infected endocarditis, rheumatic heart disease, whatever you want to call that, when it starts affecting the valves of the heart and lays down those vegetations, those hard little plaquey things on the valves of the heart, right? Remember that? Okay? Same thing, like the antibodies tend to attack the antigens from strep at those heart valves, they also have another preferred place in the body, and that is at the glomerulus. Okay? Therefore, we have something called post-streptococcal glomerular nephritis. Okay? Think about what happened in the heart valves, and now think about the same thing happening here. Right? Got your blood coming in your afferent arterial, and then you have this war going on, right? Your agglutination, your antibodies, antigen complexes, laying down plaques, right? And of course, you're trying to get that fluid from the blood, along with all the good stuff, or bad stuff, whichever it is, into the filtrate, except now you got all this damage here, you got these plaques laying down, and predictably it's going to give you signs and symptoms that are going to have a lot to do with basically is kidney damage, right? So if you look at post-streptococcal glomerulonephritis, you can kind of predict, if you understand that the same thing that was happening with those vegetations on the heart valves can be happening here, you can predict what the symptoms would be as far as the kidney goes, okay? red or Coca-Cola colored urine due to damaged filter. In other words, those antibodies, antigens, that war that they had kind of blew some big holes in that glomerular membrane, right? In between, remember the, what did we say? We said pickier, pickiest in your Bio 211 class when we were going through the different filtering system, remember the podocytes and all that kind of stuff? Anyway, you've got to have a pretty big hole to get blood into the urine. This is one of those things that'll cause a pretty big hole, cause a lot of damage, okay? Hypertension, why would you have hypertension based on the physiology of what's happening here? Got a patient with PSGN and hypertension. What do we know that would have to do with hypertension? Why would you have high blood pressure?
Are they retaining their salts because they can't take it in them?
Okay, they're probably retaining not only their salts, but a lot of the water too. If you think about it, you got your blood coming in here, and fluid and salts and everything else, and it's hitting this plaque somewhere in here. Maybe this is kind of scooching right out the other end and going back into the bloodstream without dumping all those salts, without dumping water, without really making urine, right? At least as much as it should. So it's going to slow your glomerular filtration rate down, and as we already know from prior classes, was it 22 to 25% of our blood flow that comes out of the heart actually goes to the kidneys, right? That's a lot of blood flow to have an afterload, to have a blockage, right? So of course it's going to raise blood pressure everywhere else because it's not flowing through those kidneys like it should. Okay? Questions, comments? Any stories? No, I don't care. What do you got? You got some good? No.
What's it called when you get stressed out and like it attaches to your brain?
What do you call when you get strep throat and it attaches to your brain?
Yeah. It's like super, super rare. And it like causes seizures and like one-sided like paralysis.
I don't know the word you're looking for.
My best friend got it in 5th grade.
Really?
And strep throat. She had strep throat for 2 months and her parents didn't get treated. So then it like went out of control and like she like has seizures on the left side of her body and then the right side of her body she couldn't move.
Did it cause like a meningitis kind of thing, or?
Kind of, but like they didn't call it they called it like some really long name. So basically she was like constantly on antibiotics until she's 22. And if anyone has strep around her, like she has a doctor's note where she like can't be in the same classroom or anything for like 2 months after. It's like super bad.
Yeah.
Is it pandas?
Did you say pandas?
Yeah, it's like an acronym, I guess.
I hope so. Otherwise, we're talking about a bear. What's the acronym stand for? Pandas.
It's like, I don't know, it's just all in caps.
Okay. Anyway, so I don't know. Whatever. Okay. So this was our thing we were talking about, remember? The glomerular membrane. This is, I think, the same slide from your 211 class, where you got your fenestrations, and then you got your basement membrane as another filter, and then your third filter is in between the podocytes, right? This is the filter, and from that slide that you had in Bio 211, they had a red blood cell on one of the slides. It was basically, if you were taking this whole thing, about the whole rest of this entire screen was about the size of a red blood cell. So again, when you have red blood cells, makes it through there, that's a lot of damage. Okay? Alrighty, so, case study. What time is it? 10:30? Yeah, we're fine. Emily is on the varsity track and cross country team at her high school and is continuing to practice on her own during the summer vacation, but she has felt really lethargic and worn out the last week. She went to the local clinic, and the nurse practitioner found during further questioning that Emily has frequent headaches with fever, arthralgia, dysphagia, swollen lymph nodes, and is generally exhibiting symptoms consistent with a viral infection. What virus might be responsible for this illness? Why do you say strep throat? Okay. Okay. Swollen lymph nodes, dysphagia, fever. Although those all do go with strep. Is strep a viral infection? Okay, so now what? Looks like strep, acts like strep, but it's a virus. So yeah, now we're gonna start thinking maybe mono, but what virus again? Mono's not a virus, right? EBV, right? Epstein-Barr virus. So we already talked about that before. By the way, what are the things EBV is associated with? We obviously have mono. We have the other ones. Remember? Burkitt and Hodgkin's. Yeah? There's 3 of them, right? Were there more? Not yet? Okay, I think we get one more eventually. All right, how do you test for this suspected virus if we think it's Epstein-Barr? Any ideas? Huh? Look at the blood, sure. You know what that test is called? EBV test? No, kinda. It's actually even more obvious. They actually named the test to test for mono for EBV is called the monospot test, right? So, yeah, I was like, hey, monospot, okay. How might Emily have contracted this illness? Kissing? Huh?
Sharing water bottles.
Sharing water bottles, I'm sure.
That's what happened in cheerleading.
Huh?
That's what happened in cheerleading.
How
There's
many
30
of
of
Yeah,
us.
because cheerleaders share water bottles as their main way to get mono.
Okay, I'm saying like 30 out of like the 50 girls in our gym got mono.
I'm just saying, okay. I'm just messing with you.
I was one of them, so.
Okay. So yeah, somehow somebody's swapping spit, right? 3 diseases again? We already said that. Yeah. Prognosis. As in, how's this going to turn out for Emily? What?
If she doesn't get it taken care
How do you take care of this?
of,
It's not a biotic. It's a virus, right? Can you take medicine for that?
Antiviral.
Do you have antiviral medicine for mono? For Epstein-Barr? For all practical purposes, not really. It's not worth it. Viruses are very specific on what treats them, and it's not really worth it for mono. In other words, how long is this going to last? Huh? 2 to 3 weeks? Yeah, maybe months. People don't tend to get over mono that fast. I've heard anywhere from a couple months to 6 months, even a year. Mono takes forever, apparently, to get through. Most viruses, yeah, absolutely. 2 to 3 weeks, they ran through your system, you're good to go. Mono, take the weeks, turn them into months, and maybe by then. It tends to wipe people out for a pretty long period of time. What abdominal complication might result? Okay, inflammation of the spleen. Okay, it's one of the things that doesn't happen very often. No, it's like 1% of the time or something like that. However, have you ever known anybody who's got mono on any kind of sports? What happens to them? Yeah.
I wasn't allowed to play because they didn't want us anywhere.
Yeah, you weren't allowed to play because you didn't want your spleen to rupture. Again, it only happens like 1% of the time, but like 99% of coaches are going to bench that person pretty much for the season. Did you lose like 25 people on your team?
Yeah, it was bad.
So you had like no cheerleading that season?
Well, I was part of like, I was like a club team, like a,
Uh-huh.
like a.
Oh, okay.
It
All
wasn't
right.
like a high school team or
All right.
anything, but I mean, they still paid thousands of dollars and things like that.
Well, bummer.
Yeah.
So they got no cheerleaders. No, they had you.
They had like, there was still like 20 people on my team.
Yeah.
It just went down in division.
Oh,
We went from
interesting.
large to small.
But yeah, they do that. They, typically you are gonna, coaches just don't want it, they don't wanna mess with it. Like, I don't wanna be the 1%. You know, I mean, that's one person busting a spleen out of every 100 athletes. If you think about it like that, that's totally not worth it. Having said that, I was asking a class a few years ago, and this one guy, he was a lineman, and he got mono, like right before the state championship. And the coach was like, nah, I play anyway, because it was like the state championship. He didn't bust it though, that's good.
Took a risk.
So as far as mono, keep in mind, it looks like anything else as far as the sore throat part of it, the swollen lymph glands, they all kind of look the same. Fever, fatigue, sore throat. The things that stand out, of course, is that you have that spleen involvement. Here's the thing, is we know from strep that you're going to get strep, you're going to get fever, pharyngitis, lymphadenopathy. However, somebody somewhere decided this is a triad for mono, because even though you can get lymphadenopathy with strep, mono is more lymphadenopathy. Does that make sense? Okay, so again, this is one of the things you should remember as a triad, a big buzzword, big buzz phrase, whatever you want to call it, for mono, not so much strep. Okay, again, I didn't make the rules, I'm just passing it along. Okay? So yes, it is possible to have it in strep, but this is going to be the thing that's going to be like, no, if I have to guess, I'm guessing mono. Cool? So yeah, takes a month or two actually to incubate. That's interesting fun fact. I said this before, 95% of the population has Epstein-Barr. Oh, by the age 35 to 40, I guess. I think I said 25, whatever. Yeah, most people are going to get Epstein-Barr, exposed to it somewhere along the line. Okay, already saw that. Malaise, headache, fatigue, arthralgia. Again, why this isn't in the triad, I don't know. But you tend to get achy joints from mono. And of course, our little spleen thing. Questions, comments, good stories? We got nothing. Nobody wants to fess up a mono story other than her, and it wasn't her, it was everybody else on the team. Okay, fine, be that way. So here's our testing. As you can see, we do have some very specific tests for mono. The mono spot, that one's easy to remember. The viral capsid antigen, VCA, that's another one. You should probably try to memorize that one too. Okay. Just because it's more accurate, the VCA is more accurate than the mono spot. Cool? All right, so on, what is today? Tuesday. On Thursday, we'll get back to this. We kind of already talked about GERD, but we'll mention it again. We'll move on. Who knows? Might even finish up this section on Thursday. Yay?